Paul Graham from OptimalBody.ca. Today I'll be going through some common exercises to help strengthen if you have anterior knee pain or pain on the front of your knee. Often with people coming in with anterior knee pain, we'll see issues around the hip or the ankle. So it's very common for there to be dysfunction on the joint above or below where the site of pain is located. For these exercises, I recommend that you do 1 to 2 sets of 30 to 60 seconds for each exercise. The more frequently you're doing them, probably the better results you'll be getting. If you have anterior knee pain, you can be working these things into your routine anywhere from 2 or 3 times a week up to even daily. Rolling your glute med. So with this, you're going to take a foam roller and you're going to put it right underneath your hip, just above the leg bone. So if you feel the side of your hip, you'll feel a big bone sticking. That's the top of your thigh bone. I want you just above that. And then you're going to push back and forth, looking for any sensitive spots through the side of your hip. If you find a sensitive spot, just roll back and forth on that sensitive spot for a little while. You're essentially giving yourself a self-massage. You don't have to be getting in incredibly deep. You just want to roll a little bit to increase blood flow to that area. Clams. For this exercise, we're going to be trying to strengthen the side of the hip. So with this, you want to lie with your back flat up against a wall. This is going to make sure that you're not cheating and you're keeping your pelvis stable. Get your knees up at about 90 degrees with the body, and also have your knee joint at about 90 degrees as well. You can use your arm as a pillow, or if you find this causes discomfort in the shoulder, you can get an actual pillow to put underneath your head. Then what you're going to be doing is lifting your knee up like you're a clamshell and going back down. You're looking to work the side of the hip of the top leg. And so you keep lifting the knee up and down as you go. You can also put your hand on the ground to stabilize you. Commonly what will happen is a lot of people will tip and rotate through the pelvis. This is why we put the back up against the wall. If you're looking to make this exercise more difficult, you can put a looped band around your knees and go through the same motion. For this exercise, we're trying to strengthen the glutes, so the big muscle right in your cheeks. So with this, I'm going to get you lying on your back. I want your feet a little bit wider than shoulder width, lying flat on the ground. You're going to push through the bottom of the heels, but keep the feet flat. Pushing your hips up towards the ceiling, trying to squeeze your glutes together, then going back down. Pushing up through the bottom of the heels, squeezing the glutes together, going back down. So as you're performing this exercise, hopefully you're going to feel contraction, maybe even start to get a little bit of fatigue right through your glutes. Commonly, a lot of people will have problems getting their glutes to contract. So we have a little trick that can help people start to get more contraction through their glutes. For this, you're going to slide a looped band around your knees. Then you're going to go through the exact same exercise, but just think about gently pushing your knees out against the band as you're going up and down. As I switch angles, you can see me gently pushing against the band. It'll almost feel like you're pushing out on the legs, except it'll keep the knees lined up with the toes. Commonly, a lot of people, when they come to the bottom, will let the knees sink in a little bit, like this. Try to make sure you keep that tension, squeezing the glutes each time you come to the top. The next exercise we call stork stance. So for this is to work on just general stability. So we find a lot of people will have challenges in terms of just staying stable on one foot. So this exercise, what you're going to do is get your palms facing forward, get up tall, pretend like you're in the military, think really tall through the whole spine. Then you're going to lift 1 foot up off the ground and try to stay as close to a statue as you can. So trying to stay really stable. At first, you might find that your body moves quite a bit. That's okay. Just continue working on trying to get more and more stable like a statue as you go. Common mistakes that tend to happen. A lot of the times what will happen is your body will put the thighs together like this, like they're pushing or clamping together to help get stability through the hips. So make sure you have a little bit of a gap between your legs as you stand there.